Stem cells revolutionized regenerative medicine, but science is evolving beyond cells alone. For stem cells to function effectively, they require biochemical communication. Without proper signaling, inflamed environments may reduce their regenerative potential. Research shows that many healing effects once attributed to stem cells actually come from tiny messengers called exosomes. Exosomes carry biological instructions, proteins, RNA, and signaling molecules, guiding damaged tissues on how to respond and repair. In regenerative medicine, exosomes are emerging as key biological regulators. While promising, exosome-based therapies are still under clinical development. Exosomes improve the environment where stem cells work, amplifying regenerative signals, regulating inflammation, and helping tissues respond more effectively. Because exosomes are cell-free vesicles, they do not divide or migrate unpredictably, supporting a more controlled therapeutic approach. Their natural biological structure may reduce immune reactions, making them valuable in patients sensitive to inflammation. With defined molecular signals, exosomes may support more consistent regenerative responses across patients. Modern regenerative medicine focuses on coordination. Stem cells initiate repair, while exosomes regulate and guide the healing process. This combined strategy reflects how natural biological repair happens, through multiple signals working together. For expert regenerative guidance, Global Stem Cell Care provides patient education, assessment, and personalized planning based on evolving stem cell and exosome research.